Welcome, and thanks for joining us. Today, we're going to talk about AARP Medicare Supplement Insurance Plans from UnitedHealthcare, chosen by more Americans than any other Medicare supplement plans. A lot of this information can be found in the Medicare Supplement Clarity Guide. Feel free to page through as we go, or ask your local UnitedHealthcare licensed insurance sales agent or producer for a copy when we're done. If you have questions afterward, they can also help you understand your choices, so you can enroll in the coverage that meets your specific needs. But right now, let's spend a few minutes talking about AARP Medicare Supplement Plans and how they may help you take charge of your health care by giving you more choice, more control, and more freedom. Let's get started. Before you can decide if a Medicare supplement plan makes sense for you, it's important to understand the basics. You can find this information on pages 2 and 3 of your Clarity Guide. Medicare, often called Original Medicare, is a federal health program that most Americans qualify for when they turn 65, and it includes 2 parts. Part A covers things like inpatient hospital care and home health care. Part B covers things like doctor appointments and outpatient services. And while Original Medicare provides good coverage, it doesn't pay for everything. For example, Medicare usually covers about 80% of your Part B costs. The rest is your responsibility. The good news is you can get additional coverage. If you decide you'd like to have more coverage than you get from Medicare alone, you have a few different options. You can keep your Medicare coverage and add additional coverage by enrolling in a Medicare supplement plan, which may pay for some of the out-of-pocket costs not covered by Original Medicare, like coinsurance, copays, and deductibles. You can also get a standalone Medicare Part D plan to help pay for prescription drugs. Or you can replace your Medicare coverage with a Medicare Advantage plan. Medicare Advantage plans include all the benefits of Original Medicare, and they can also include additional benefits. Now, before you can enroll in a Medicare supplement plan, you first have to sign up for Medicare. On page 4 of the Clarity Guide, you'll see that there are several clearly defined times to enroll. The first time you can sign up is called your initial enrollment period, which for most people happens when you turn 65. After that, each year there's an annual enrollment period, which runs from October 15th through December 7th, when you can add, drop, or switch your Medicare, Medicare Advantage, or Part D coverage. You may also qualify for the general enrollment period, which runs from January 1st through March 31st. If you didn't sign up for Medicare during IEP, this is your opportunity. However, you may face late enrollment penalties for waiting beyond IEP to sign up. And if you experience a big life change in the middle of the year, you may qualify for a special enrollment period, which allows you to change your coverage right away. Talk to your agent or producer for more details about Medicare enrollment periods. Once you've signed up for Medicare, you can sign up for a Medicare supplement plan at any time during the year. On page 5 of the Clarity Guide, you can see some of the important details about Medicare supplement plans. As a reminder, these plans work with Original Medicare to help pay for some of the things that Medicare doesn't, like coinsurance, copays, and deductibles. When you choose a Medicare supplement plan, you get more choice. You can go to any doctor, hospital, or clinic that accepts Medicare patients. You get the control to see any of these doctors without a referral. And you get the freedom to use this coverage while you're traveling anywhere in the United States. Some plans even have additional coverage if you're traveling out of the country. On pages 6 and 7 of the Clarity Guide, you'll see a detailed chart that outlines all of the AARP Medicare Supplement Plan options. With some plans, the only thing you'll need to pay is your premiums and your Part B deductible. After that, you won't have any out-of-pocket medical costs the rest of the year. Other plans may offer lower monthly premiums with out-of-pocket costs based on your individual needs. Keep in mind that not all plans are available in all states, so talk to your licensed agent or producer to see which plans are available where you live and to help you find the AARP Medicare Supplement plan that best fits your needs. Now, one final thing about Medicare Supplement plans. The basic benefits offered by each plan are standardized, meaning they don't change from company to company. But there can be a big difference in the service you receive. AARP Medicare Supplement insurance plans are the only Medicare Supplement plans to carry the AARP name, which means they've been carefully evaluated and selected to meet the high service and quality standards of AARP. And with more than 40 years of experience and over 10 million members covered nationwide, UnitedHealthcare is the #1 provider of Medicare coverage in the country. Maybe that's why 94% of plan holders surveyed say they're satisfied with their customer service. 94% of members say they're satisfied with their plans. And 94% of our members renew their plan each year. If you have questions about your AARP Medicare Supplement plans, your UnitedHealthcare licensed insurance sales agent or producer is ready to help. They can show you how these plans provide more choice, control, and freedom than you get from Medicare alone. Thanks for your time today. Now that you know more about your Medicare coverage options, we hope you'll take the next step and take charge of your healthcare with an AARP Medicare Supplement insurance plan from UnitedHealthcare.